cardiovascular system, and now we're going to be looking at the actual individual arteries and veins, learning the names of them, the identification of them. In all these diagrams, you will notice it's kind of a standard procedure that the oxygen-rich blood is going to be shown in red and oxygen-poor blood is shown in blue. The schematic flow charts are going to show the vessels closer to the surface of brighter colors, and those that are deeper are going to be in a darker shade. In terms of trying to learn the names of the vessels, keep in mind that not always, but normally the name of the vessel is going to be related to the body region where it's being found, where it's traveling through, such as the brachial or femoral. It may be named after the organ that it is supplying, such as renal for the kidneys, or it may be after the bone that it is supplying, such as the radial. So usually you can look at the region or the organ that's being supplied, and that's going to give you a clue, at least a hint, as to what the name of the arteries and veins are going to be. Usually the arteries and veins are going to run side by side, especially the deeper ones, and they'll also be named for that location. And there's usually a third thing that's also running, and that's going to be a nerve that's running along the arteries and veins. Sometimes with the systemic vessels, the right and the left side are not going to be matching. Some of your larger, deeper vessels in the trunk are unpaired, so there may not be a matching vessel, say an artery to a vein. So this is showing the major arteries of the systemic circulation. As you leave the left ventricle of the heart, you are going to be going out the aorta, and now from the left ventricle you're going to have the coronary arteries feeding the heart itself. As you know, as the blood goes up the aorta, you do have three main branches at the aortic arch at the top of it. You have the brachiocephalic, which is going to supply the head, the neck, and the right upper limb. From there, it continues to branch off into the right common carotid artery, which then is going to further branch into the right internal carotid artery and the right external carotid artery. From that branch, the brachiocephalic continues, becomes the right subclavian, which you have a break off to the right vertebral, and then finally the right axillary, and then that's going to continue on down to the right limb, upper limb. The second main branch from the aortic arch is going to be the left common carotid artery, which services the left side of the head and the neck, and that further branches into the left external carotid artery and the left internal carotid artery. And then the third main branch off the aortic arch is going to be your left subclavian artery, with branches to the left vertebral, left axillary, and down to the remaining arteries servicing the left upper limb. As the aortic arch then almost looks like it does a U-turn, so it comes up from the left ventricle, you have the arch, and then it extends down the back side of the heart and travels down. And then you have additional branches off of the thoracic aorta. That's what we call it, as it's passing through the thoracic cavity area. And so you have parietal branches, you have the visceral branches, as it is serving things such as the esophagus, bronchial arteries servicing the lungs, the posterior intercostals, the superior phrenics, and then it is going to pass through the diaphragm, and below that's referred to as the abdominal aorta, where once again you're going to have the visceral branches and the parietal branches in the abdominal cavity. It then is going to extend down and finally branches forming the right common iliac artery and the left common iliac artery. Those are going to both service the lower pelvis area as well as the lower limbs. Now, for some people, other people prefer to see an actual illustration of the body and find it a little bit easier to follow that way. So find the one that works for you. So once again, with the heart here, we've got the aorta, the aortic arch, and as you can see, the three main branches off of that. These extend up to the head, to the upper arms, the upper limbs, further branching. The arteries, as you know, get smaller and smaller as they extend down. The aorta goes behind the heart through the diaphragm. Now you're in the abdominal aorta, and then here is where you see that split forming the right and left iliac, common iliac arteries. It will continue to split as it extends down into the limbs. So find which makes sense for you, obviously, and really the best advice that I have for learning them is just sitting down. Find a picture that is not labeled, and then what I recommend is make a copy of that, put it into a plastic sleeve that you can easily find at Walmart or Target or any of your office supply stores. And if you put it in a sleeve, then you can use an erasable marker and practice labeling them, and then erase it, wipe it clean, and start over again. And it's just that repetition that's going to help. And hopefully, at this point with A&P, you're familiar with the different anatomical region names of the body. And so that should help you with learning the names. You know that the brachial region is in the upper arm. So it would make sense that if you're looking for the brachial artery, that guess what? It will be in this region right here. Don't look for it in the leg. Axillary, that's the armpit. So this will be in this region right here by the armpit. Where is the femoral region? Where you have your femur, you've got your femoral nerve, and guess what? Now you've got the femoral artery in this region. So stop and think about the area of the body that you are looking at, and that's going to help you with naming them. As we go in further detail and look at the different areas of the body, you're going to notice that it has both the schematic flow chart and the illustration of the body. So once again, just look and see which one is going to help you better. So here, this is showing a little bit more detail, the aortic arch. You have the brachiocephalo trunk, which is going to now immediately further branch into the right subclavian artery and then the right common carotid artery, continue branching up. Now you've got the carotid artery is going to further subdivide into the external and internal carotid arteries and extend on up, move up into the brain. You'll notice that there's this circle, essentially. This is very beneficial in that you have multiple ways of servicing the brain. So if one area becomes blocked, say if there's a blockage right here, you still have blood coming up here through the middle cerebral artery that can still service the area and not prevent blood from reaching all areas of the brain. So once again, it's going to involve just looking. So right here's your right subclavian artery. As it moves down towards the armpit area, it's called the axillary artery. You have the various arteries going up through the cervical area. The common carotid, which, as we said, splits. The outer portion is the external, and then you have the internal carotid artery, which moves up further into the brain. The external carotid artery is going to extend up and serve more of the superficial areas. You do have, in the temporal region right here, superficial temporal artery. You do have the facial artery that's going to extend here on the surface, as the name would imply, servicing a lot of the facial bones and the skin covering the facial bones. This is a colorized picture showing the flow of the supply of blood in the arteries to the brain. So obviously the brain, very important organ, and it's so delicate, and there's a very extensive blood supply to it, as you can see here. From a posterior view, this is showing once again the major arteries that are servicing the brain from this posterior angle and the anterior angle looking up. So the posterior is down at the bottom, anterior is at the top. So you can see the different lobes and how the blood supply once again is coming in, and you have multiple arteries servicing multiple areas. So that once again, if there is a blockage here, you still have other arteries that are bringing blood and the nutrients and the oxygen to that area. This area here, once again, is known as the circle of Willis, so that you have multiple ways of supplying blood. In the upper limb, this is on the right limb, so you initially have the brachiocephalic trunk, which then immediately then branches, and you have the right common carotid artery heading up towards the brain, and now the right subclavian artery is going to head towards the arm, the limb itself. Right in the armpit area, you have the axillary artery. You do have branches coming off of that, and then as it extends down the arm, it forms the brachial artery, and then we have a branch right here. And guess what the names are? Well, the artery that's running over the radius is going to be the radial artery, and the artery that's running over on the ulna is going to be the ulnar artery. And as you can see here, with the artery superimposed over the bones, and on the innermost one, remember, that's where the ulnus is, so that's where the ulnar artery is. The outer one is the radial, and then it's going to come down here, and notice it kind of makes an arch. They'll join here. So the blood coming down the brachial artery, there's a fork in the road. Some of it goes down the radius, some goes down the ulnar. It is also showing in this picture how you do have the arteries that you have your descending aorta right here, and branches off of that are servicing the different thoracic arteries, different muscles such as the intercostal arteries, etc. Different components feeding into the area. And then the descending aorta is going to extend down. There is an opening that is able to extend through the diaphragm. And so below the diaphragm, it's referred to as the abdominal aorta. So thoracic aorta in the thoracic cavity, just right after it makes that turn and starts to move downward, is where it's the descending aorta, then the thoracic aorta, and then abdominal aorta. You are going to have branches coming off of the descending aorta. Some of these are going to be servicing things such as the renal arteries, are servicing the kidneys. You've got the gonadal arteries for the reproductive organs. You have the celiac trunk here, which you have noticed these two different pathways here, the splenic artery, the common hepatic artery. These are going to be servicing the stomach, up here the spleen, the pancreas, you've got the liver, etc. So on this diagram, it might be a little bit easier to see the celiac trunk and the branches from it. So here is the aorta here. And then you've got these branches coming off here. Here's the common hepatic artery. And then you've got these branches going here to the liver. You have over here, this is the stomach right here. Here is the splenic artery, which, as you can see, is going to pass behind the stomach and go to this. This is the spleen right here, so it's going to feed it. This structure behind the stomach, come and back a little bit under that, is the pancreas. The gastric artery is going to be feeding the stomach. It branches off right here and then twists around here. It's kind of like a maze. Just follow and trace down. If we were to ask you if you had a drop of blood in a certain location, can you trace that drop of blood as it goes from point A to point B? Hiatus, that's the opening, what we call the opening in the diaphragm. You have one for the aorta and one for the inferior vena cava. You also have an opening for the esophagus to move through the diaphragm. So once again, you're looking as you continue traveling down, and certainly right here you can see the renal arteries as they are supplying the kidneys. And then as you come down the abdominal aorta, remember down here is where you have this split, the common iliac artery that's the right and the left. These are going to extend down then into each of your legs. This is showing the superior and inferior mesenteric arteries. They're helping to supply the intestines, both the large and small intestines, and basically also within the, as it continues down, within that whole abdominal pelvic trunk area. Here's a schematic flow chart for the arteries along the right pelvic cavity and then the lower right leg. Once again, once you have that split from the abdominal aorta, it goes to the common iliac artery. You have branches off of this. Some of this is helping to serve right here in the lower pelvic area. And then the external iliac is going to continue on down towards, now you're in the upper leg, and then it becomes the femoral artery. Down, notice you have some of these branches will go more internal or deep, and some of them remain more superficial. The popliteal artery, remember think of the area, that's the back of the knee. And then you have further branching as it continues down, all the way down to the feet. And here's the drawing showing the same. Once again, just follow as though you're a drop of blood where you're going to travel. And then once again down in the foot, this is a posterior view. And so now we're going to look to the veins, drawing the blood back up towards the heart, the systemic circulation. Remember that the names are often going to be very similar to what the arteries that are going to be lying typically right adjacent to them. Superficially, veins can be superficial, but usually your arteries are not, so they will probably have a different name. As you can just see here, in general, the veins in the lower limbs, the blood's going to be flowing now back. They converge, emerge together here in the inferior vena cava, which is going to pass through the hiatus, through the diaphragm, and it's going to be returning the blood to the right atrium of the heart. So the inferior vena cava is returning blood, as you know, from the lower legs and the abdominal pelvic area, everything below that diaphragm. The superior vena cava is going to be returning blood from the head, the neck, and from both of the limbs. And that's going to come, the veins merge together, forming the superior vena cava, and return that to the right atrium. And once again, here you can look once again either at the schematic flowcharts or drawings such as this, where you actually, for some people, find it easier to see how and where they're located in the body so they can identify them. Ultimately, that is what you will have to be able to do. Not only be able to know how they're connected so that you can trace a pathway of a blood drop from one region to another, but also so you can actually identify the various blood vessels. And now, just like they did for the arteries, for the veins, they're going to break it down into different areas of the body. So from the head, the neck, and the brain, where you have all the blood coming together, and instead of the branches out, they're merging together now. The venules coming together, forming the veins, and they get increasingly larger and larger and larger. So here you have your internal jugular vein. This is the external jugular vein. The vertebral vein, these are all, and this is the subclavian coming from the arms, and they're all going to merge together and eventually form that superior vena cava. As you can see here, the veins as they come through and merge. The venous drainage in the brain, you have the dural venous sinuses, you have these enlarged areas where the blood is traveling through and can pool a little bit more as it's collected. For the thorax and the right upper limbs, once again, you have got the various veins. Remember, the darker color is here going to be the more superficial. The naming of it is often by, once again, the region of where they are. So you can see how they all merge. Some are surfacing deep, some more superficial. They merge together, back around, ultimately, once again, back to the superior vena cava. And in the abdomen, now this is looking the hepatic portal system. This is the blood that is surfacing the liver. So you have the blood that's going to the liver, and then as it is draining the liver. Hepatic refers to liver. You can see here the hepatic veins. Here's the inferior vena cava. This is the right suprarenal, left suprarenal veins coming in. Here are the renal veins. They drain into the renal veins, which come into the inferior vena cava. And then you've got your common iliac veins coming in. Here's the external. You have the internal. They're all going to merge together, forming that inferior vena cava. The hepatic portal circulation is special. Basically, in blood that has gone to the intestines, which is where you have absorption of all the nutrients from whatever it was that you ate. Those nutrients are absorbed into the blood. It's going to be gathered. Here's your small intestines. Here's your large intestines. Most of the absorption is occurring in the small intestines. So it has quite the extensive blood supply. And then it is going to be moving up through here, which is the hepatic portal vein. That blood is going to move to the liver. Here are your hepatic veins here. In the back here, you can see where the inferior vena cava is. Gastric vein, gastric refers to the stomach, and then once again the spleen is back over here. This is showing the schematic flow chart for the lower limbs. And then as you can see on the drawing here, so you've got your anterior tibial vein, fibular vein coming up, small saphenous vein, the popliteal vein. Now up here is the femoral extending on up, eventually draining in to the iliac veins, which will inferior vena cava. So just an enlarged view. What are some of the developmental aspects? There are some things that are different in the developing fetus versus a newborn after birth, and then as we age. A couple things just to keep in mind. Early on, the heart is developed as well as the blood vessels. The heart is pumping blood, actively pumping by about 4 weeks after fertilization has occurred. There are certain shunts that we see in the fetus to bypass the lungs because the lungs are not functioning. They do not function until birth. And so the foramen alveoli and the ductus arteriosus bypasses. The ductus venosus will bypass the liver. Once again, the mother is doing all of the filtration in terms of when nutrients are absorbed. So yes, you have blood supply to keep the tissue developing and alive, but it's not functioning in the normal way of the lungs or the liver functioning from that normal standpoint. The umbilical vein and umbilical arteries are circulating blood from the mother to the placenta and back. There is no mixing of the fetal blood with the mother's blood. They come very close to each other, so you have exchange of nutrients, gases, and waste products, and some proteins such as antibodies can pass, but there's no actual physical mixing of the blood. Vessel formation throughout life is going to occur to help support growth. It's going to help support whenever there's been a wound and healing that has to occur and maintenance. Certainly in females, we rebuild vessels that are lost during the menstrual cycles. With aging, you have potential, not everybody gets it, but you have potential risk of varicose veins, hardening of the arteries, the plaque buildup with arteriosclerosis, and also a big one is potential of increased blood pressure. It's often known as a silent killer because a lot of times people do not realize they have high blood pressure because they don't show active symptoms as soon as it develops. It may take a long time for it to arise.